Listen for at least about 10 to 15 seconds at each spot, and you would be listening for any clicks, gallops. You would want to hear your normal sounds, your S1, S2. Listen for any murmurs, any swishing, anything like that. And she appears to have a normal chest exam. So at this time I'm going to ask Laura to lay back. I'm going to have to move the table back. Are you comfortable? Is that too far? That's good. Okay. And I'm going to pull the table out here so she's not dangling. And then we're going to do the abdominal exam. And I'm going to ask Laura, is it okay if I lift your shirt up, Laura, so I can assess your abdomen? And when I'm looking at her abdomen, initially I'm going to just get a generalized appearance of her abdomen to see if I see any discoloration. If we saw any kind of purple discoloration, any jaundice, that would be, we could consider that there would be some possible liver disease. If we was assessing somebody for acute injury, if we see any bluish discoloration, that could be associated with internal hemorrhage from some kind of a trauma. But I'm just getting a generalized idea, looking for a distension. But then I'm going to start out by listening to bowel sounds. So I'm going to have to listen over all 4 quadrants. And she has good normal bowel sounds. And I'm also at this time I'm going to listen right above the umbilical area to see if I hear any kind of bruise that could be indicative of any kind of aneurysms or any leakage. And I do not detect anything abnormal. And then I'm going to palpate the abdomen. And I'm going to check the liver and the spleen, and to see if I feel any abnormalities, enlargement. It's kind of hard to really feel enlarged livers on patients, but it is something that's part of the assessment. So I'm going to palpate at the liver area, and I'm going to ask Laura to take a deep breath in and release. And then I'm going to go to the spleen area, deep breath in and release. Do you got any tenderness anywhere? I'm going to check in all 4 quadrants. Any tenderness here on the lower abdomen. And then while I'm here, I'm going to check her femoral arteries and her inguinal lymph nodes to see if I have, is there any tenderness there? She's got good pulses there. Okay. We'll put your shirt down now, Laura. Okay, and now I'm going to go ahead and let Laura sit back up. So I'm going to put your table in and let you sit back up, because then we're going to go on to the musculoskeletal exam. Okay. And I'm going to start the musculoskeletal. Do you need to be up a little higher, Laura? Comfortable? Okay. I'm going to start by checking her reflexes, and I'm going to start with the triceps, biceps, and I'm going to just take the reflex hammer, and I'm going to check for reflex there. And then I'm going to check at the radius. I'm going to check the other side. And then we're going to go down to the lower extremities and check at the patellar. And then I'm going to go behind and check there. Okay. And then I'm going to start back with the upper extremities to check for her range of motion and strength. So I'm going to ask her to grip my hands again. Good equal grips. Okay. And then I'm going to go down and I'm going to check her legs. She has pants on, so I'm obviously, in this setting, I'm not going to undress her completely, but I can pull her pants up and kind of look to see if she has any signs of discoloration to the lower extremities, any signs of edema, any shininess, any signs of healing, possibly diabetic ulcers or peripheral vascular ulcers from poor circulation. I'm going to take your socks off, Laura, because I need to check your feet to do a diabetic foot exam. So I'm going to take both socks off. I'll let you put them back on in a second. And we're going to just check the foot for any signs of diabetic ulcers. And I'm going to check both feet. And I'm going to check in between the toes. Melanoma is commonly found in between the toes, so we would check in between your toes to see if we see. And a lot of people just don't check their feet for possible melanoma, so you could at that time educate your patient about that. Another thing, I'm going to ask you to close your eyes right now, Laura, and I'm going to touch your toe. Tell me if I'm pulling up or pushing down.
Up.
Okay. And I'm going to go to the other foot. Am I pulling up or pushing down?
Down.
Okay. So she appears to have good sensation. Can you feel me touching the back of your foot? Okay. So we're going to put her socks back on her. She's got nice little pretty pink socks on today. Okay. Okay. Now we're going to check her range of motions in her lower extremities. So I'm going to ask you, Laura, to, I'm actually going to pull the table back out for you right now. I'm going to ask you to raise your leg up off of the table and do your left leg the same way for me. And then I'm going to ask you to take your right foot and with your great toe, raise your right great toe up and do your left foot the same way. And then take your right foot and raise your complete foot up. And then same. And then I'm going to ask you to press on the gas like you were driving with both feet. Okay? And then I'm going to ask you to take your knees and push them out. And then push them back together. Okay? And then you can straighten them back out. And raise your legs up off the table, both of them. Okay. And then we're going to push the table back in. And I'm going to ask her if she can kick her leg up and do the left leg the same. She appears to have good range of motion and strength to her lower extremities. Now we're going to check the upper extremities for range of motion. I'm going to ask you to make a muscle like Popeye does with both arms. And then I'm going to ask you to extend them out. And then drop your arms to your side, like, okay. And then extend your arms out for me. And then push them together, okay. And then I can check the grips again at this time. And she has good grips. And she appears to, you can put your arms at your side now, Laura. She appears to have good range of motion and good strength to her upper extremities. And then the last thing that we're going to do with this exam is do the cerebellar exam. So I'm going to ask Laura to hold her arms out and with her palms up, okay? And then I'm going to ask you to close your eyes, Laura. I'm going to ask you to take your left index finger and touch the tip of your nose and do the same thing with your right. And then I'm going to ask you to open your eyes and take your index fingers and touch my index fingers. Okay. And then I'm going to ask you to stand up. I'm going to pick up my trash that I dropped on the floor. And I'm going to ask you just to close your eyes. And if you were doing this with a patient in the hospital or the clinic setting, you can open your eyes, Laura. But with a patient that you were really assessing this on, if you were suspecting some kind of cerebellar disorder or that you were suspecting some kind of neurological problem, you want to be prepared to catch the patient in case their balance was off or something like that. And the last thing I'm going to ask you to do, Laura, is to walk across the room just a little ways and then walk back towards me. And I'm assessing her to see if she has normal gait. And she appears to have normal gait. You can sit back down, Laura. And a couple things that we deferred for this exam today. This is for teaching and a learning process. If we were doing this in a real setting, if Laura came into the clinic or the hospital for us to do a actual head-to-toe exam, we would actually do a breast exam on Laura, and we would check for any abnormalities, any nodules, any abnormal lumps or tenderness or swelling, indentations, discharge from the breast or the nipple area, and we would document those findings. If we were doing a vaginal exam, we would do a vaginal exam to check for drainage, discharge, any redness or discoloration to the vaginal area. And then if we were doing a rectal exam, which of course we deferred all these for this assessment today, we would do a rectal exam to check for any possible hemorrhoids, any rectal bleeding, any fissures, anything abnormal or abnormalities, or even possible drainage or tenderness, anything like that from the rectal area. And that would conclude our assessment for today. I want to thank you, Laura, for agreeing to participate and be my patient for the day. And that concludes my assessment for my nursing assessment class for William Jesuit University. Thank you.